Hi guys, Dr. H here, your source of musculoskeletal care. And this is the second video in a video series talking about how resistance training or strength training produces a ton of health benefits and really decreases your risk of illness and death. So if you haven't seen the first video, I recommend you check that out now. I'll leave a link to it up here. But pretty much in that video we discussed that exercise is great, but if you have to pick one exercise, it should be strength training. In other words, strength training really needs to be the foundation of your exercise program. It's certainly best, and I have to recommend as a physician, that you do both aerobic exercise and resistance exercise. But again, that resistance part, that's where you're going to get the most bang for your buck and the highest yield, and therefore that needs to sort of be the foundation of your exercise regimen. In this part 2 video, we're going to kind of do a deep dive into muscle as an endocrine organ. And we'll talk about exactly what that means a little bit later. Fair warning, this video is going to get a little bit sciencey. I'm going to do my best to walk that razor thin edge of simplifying things to the point where they're quickly understood and still keeping things pretty much true. I have no idea how that's going to go. I guess we'll see. With the last video, we know strength training and resistance training and being strong keeps you alive longer and keeps you healthier for longer. But how exactly does it do that? Well, let's talk about that. Probably one of the most studied conditions where they looked at resistance training effect on that disease burden is type 2 diabetes. So we knew for a very, very long time that any type of exercise is good if you have type 2 diabetes. But in the more relatively recent years, as far as studies are concerned, they've tried to sort of tease out if one type of exercise is better than the other, or at least how different exercises have different effects for that disease. And what they found with resistance training and strength training is that it greatly improves your body's ability to manage your blood sugar. So this meta-analysis down here, and we talked about what a meta-analysis was in that last video, again, sort of a study of studies to sort of get a bigger picture of things, looked at a metric called a hemoglobin A1C. Now, for those of you who don't know, a hemoglobin A1C is a measure of how well your body was able to control your blood sugar over a longer period of time. And what this meta-analysis found was that people with type 2 diabetes who did strength training or resistance training had improved hemoglobin A1Cs. Similarly, in this study here, they showed, again, improvement in hemoglobin A1Cs, but even a little bit more than that. They showed an overall decrease in the body's insulin resistance, which is a big problem in type 2 diabetes. They also showed an improved lipid profile, or in other words, an improvement in cholesterol, so lowering of your bad cholesterol and increasing of your good cholesterol. And at least in this particular study, they compared people who sort of did no physical activity to people who did endurance training and to people who did strength training. And again, strength training was actually the winner in terms of the metabolic improvements that we saw in type 2 diabetic patients. So this sugar regulating benefit of resistance training isn't unique to people who already have something like type 2 diabetes. This study here looked at something called gestational diabetes, which is a type of diabetes you can get when you become pregnant. And what this study found was that resistance training lowered blood sugar levels in those who had gestational diabetes. And consequently, it reduced some of the risks to the fetus that comes in patients who have gestational diabetes. One of the big ones we worry about is babies growing too large in utero because of the high blood sugar. So while blood sugar regulation is one of the more frequent studied metabolic metrics that we look at, in terms of how does exercise improve health, it's not the only one. There are other metabolic effects that muscle and strength training have. This study here looked at something called resting metabolic rate. Now that's pretty much how much energy you burn doing nothing, just sitting there. And this is a sort of a major factor of how many calories you burn even when you're not exercising. And what they found is that strength training was successful in increasing this resting metabolic rate. So the study looked at a bunch of different legs. It kind of looked at just strength training, sort of a combined aerobic strength training, and then just aerobic training. And so what this study showed is that the strength training arm and the combined arm had an increase in their resting metabolic rate even after 21 hours, whereas the endurance arm did not. And now we get into some of the research that is a little younger and kind of still in its infancy. And so much more needs to be done before we can make any definitive conclusions, but I figured I would add it in this video because if it does pan out, it has some pretty important implications. So this study here looked at how resistance training might actually change the structure of fat tissue. And in ways that we'll hint on a little bit here in a second, it can take fat tissue from what's called white fat tissue, which kind of is just meant to store energy, to brown fat tissue, which is actually metabolically active tissue. Now, it's an oversimplification, but it's not entirely wrong to say brown fat tissue is better than white fat tissue. But nevertheless, like I said, this research is in its infancy, so we're going to have to wait for more studies to come out to show whether or not this might be clinically useful or clinically relevant at all. But kind of along those same lines of how resistance training specifically affects the metabolism of fat, this study here looked at what happens to what we call intra-abdominal fat, or sort of that fat that sits around your organs in your abdomen. And so that resistance training was successful in reducing this sort of around the organ or this intra-abdominal fat, at least in older women. The same study seemed to show that this effect did not occur in men, so sorry guys. We see all these interesting metabolic effects of strength training and muscle mass. It improves your resting metabolism. It reduces intra-abdominal fat, at least for some. It may even change the very structure of fat, and we've also shown how well it helps you control your blood sugar. And again, the question is why? Well, there's really two reasons. One's kind of very intuitive, and one is very much not. The intuitive reason is, well, muscle is a very metabolically active tissue. It requires a lot of energy to maintain. And so it makes sense that if you have more muscle, you're going to have a higher metabolism. You're going to burn more energy sitting there because you have more things that you need to maintain. Along that same track, muscle is one of the greatest utilizers of your blood sugar. And so the more muscle you have, the less sugar you should have floating around in your blood, essentially, because your muscles should be taking it up for their own use. But it's not quite as simple as that, right? It never is. More fascinatingly, we have shown that muscles have sort of an endocrine function. Now, what that means is that they can produce chemicals or release substances that can have effects all throughout the body, not just locally. And we've named these chemicals myokines. Myo for muscle, kine for movement. So substances produced from your muscle that move throughout your body. And so again, muscle can have wide-ranging effects. Now, researchers have identified at least over 600 myokines. It would be exhausting to go over any of them in these videos. However, I'm going to put a little bit of a graphic down here from a study that'll be cited as well that just looks at a few of them. So as you can see from this diagram below, that when muscles contract, they release these myokines, and you can see a wide variety of myokines and some of their different effects here. And obviously, the more they're contracting and the harder they're contracting, such as in the case of exercise, the more myokines they're going to produce. Again, what you can see is that these muscles can influence everything from fat metabolism, sugar metabolism, your digestive tract, your immune system. They have a serious role when it comes to things like controlling inflammation. And some of these myokines function as tumor suppressors. So you can recall from the last video where we talked about one of the most dramatic metrics that were affected by strength training was a decreased risk of cancer. Well, it's probably because of these myokines. It's probably because of this endocrine function of muscle tissue. And so the function of these myokines may go a long way in explaining some of the more unique benefits of resistance training. For example, this study here looked at breast cancer survivors and found that resistance training reduced inflammation and fatigue in people who had previously suffered from breast cancer. And again, if you read through that study, it's probably likely due to the sort of endocrine function of muscle. Kind of is an oversimplification to say that, well, the more muscle mass you have and the healthier muscle tissues, the more myokines you can produce and the better you can help with equilibrium of your metabolism and your immune system. It's not entirely untrue. It's kind of the crux of the whole situation, right? If you're doing strength training and you have healthy functional tissue, muscle tissue, and you have more muscle tissue, you're going to have more available myokines that help with this sort of regulation and the homeostasis of things like immune function, tumor suppression, and metabolism. So this video is really to show the unique metabolic benefits that strength training can impart and how these benefits can help with everything from low-grade inflammation to blood sugar regulation, tumor suppression, even fat metabolism. But the next video is going to dive a little bit into some of the other benefits that strength training imparts outside of the ones we've discussed in this video, and more importantly, how strength training and having healthy muscle mass can be protective in a lot of ways. So we'll save that for video number 3. And until then, keep moving.